Why are some of the other organs, when you study their blood supply, it's like a whole endless list of blood supply, and when it comes to the heart, it's only these things. When in fact, technically it's the heart that keeps everything alive. Okay? So, okay. Later we'll talk about these things. But note, a lot of conditions, okay? A lot of conditions occur in the left coronary artery. Why is it dangerous for the left coronary artery to be affected? It supplies the? Okay, so all of you have the same answer, right? You are all correct. It is the left ventricle that supplies the blood to your whole body. So if the muscles here die, what happens? Loss of blood supply to your body. Okay? So what's the pathophysiology of atherosclerosis? So you don't need to discuss this anymore. Okay? I just want you to correlate and show me, sample ECGs. Okay? The pathophysiology of atherosclerosis. Actually, you'll study this. You'll study the pathophysiology of atherosclerosis probably when you talk about blood as well. Okay. However, the principle behind the formation of atherosclerosis is what's known as Virchow's triad. What's atherosclerosis? It's the buildup of what? Cholesterol, fat, cellular debris. Okay? What does the word sclerosis mean? Hardening. Please note this. This means hardening. So, atherosclerosis, if you look at the word, it means hardening of the artery or the blood vessel. Why does it harden? Because eventually this plaque will build up, it will keep building up, it will harden, and once it hardens, what will it do? It will block this whole artery completely. How do you speed up the build-up of this? Keep eating food that is high in cholesterol. Yeah, in fact, Filipinos, we have lots of food. Have you guys tried some of the food in the Philippines that's high in cholesterol? Wow, there's a lot of them. Okay? So that's the reason why doctors like myself, we have to make sure that our advanced cardiac life support license is always up to date. We have to update our license every 3 years. So we have to train in advanced cardiac life support every 3 years to make sure that our license is updated. And I've also been qualified to train as an instructor for ACLS. So I have not done it yet because no time. In Virchow's triad, there are 3 factors. When you say thrombosis, what's thrombosis? Formation of a blood clot. Okay? A blood clot. So thrombosis is the formation of a blood clot. So for a blood clot to form, there are actually 3 factors involved. Okay? 3 variables. One is the blood, the second is the blood vessel, and the third is the flow. If there is an abnormality in any one of these 3, blood clots will start to form. Okay? So, for example, endothelial injury refers to injury of the blood vessel. If the blood vessel gets injured, a blood clot will form. This happens to you not every day, I hope, but I mean it happens to you whenever you get a cut. What happens? When you get cut, blood flows out. Eventually what happens? It clots and it stops. So that's what you mean by endothelial injury. Okay? A clot will form. Now, another thing is abnormal blood flow. Remember that, we'll talk about this when we talk about blood again. But note that blood should have what's called laminar flow. Okay? What do you mean by laminar flow? This is the blood vessel. The flow of blood should be smooth and forward. That's what you mean by laminar flow. If blood starts to move around like this, starts bumping into the walls, what do you call this type of flow? Yes, very good. Turbulent. Resulting to what physical manifestation you can see on PE? Murmur. Excellent. Okay? The reason why murmurs, okay, are formed because of turbulence of blood flow. It can be heard on stethoscope, but the worst type of murmurs can be heard even without a stethoscope. Okay. For those patients, I would advise them to get a memorial plan. Okay, hypercoagulability. What this means is the blood becomes very thick. The blood becomes very thick. How can the blood become very thick? One is because of a disease. Polycythemia vera, or PCV. Polycythemia vera is a disease that causes an overproduction of red blood cells. So too much red blood cells due to PCV will lead to the blood becoming thicker. And when the blood becomes thicker, what happens to the blood flow? It slows down. Very good. And when the blood flow slows down, what will happen? There will be abnormal flow, leading to thrombosis. Okay? Now PCV, some people, a lot of people are, it's actually inborn. It's genetic. Okay? Does anyone know what the treatment for PCV is? You guys have you heard of this disease? You've read about it? Okay? But do you know the treatment? No.
Bloodletting?
Yes, very good. Okay? It's bloodletting. Actually, what we call phlebotomy. Okay? What we do, we actually let the patient bleed every once or 2 weeks. No, not that type of bleed. Okay? That's a permanent bleed. Or what we do is we actually just extract blood from the patient. I had a patient before with PCV. Okay? And he would come to me every Saturday. And I would always extract blood from him. Okay? How much blood? Around 3 to 5 ml. That blood, because if I don't extract that blood, it will build up. And eventually, it will slow down his blood flow. Okay? So, I hope you understood virtuous triad. Okay? So the normal clot formation, what happens here? For example, there's a cut, okay, that occurs here. So there's a cut. What happens is the red blood cells start moving out of the blood vessel. This is what's called endothelial injury. So once the blood starts moving out the cells, the platelets will start secreting factors. Okay, and these platelets, once these factors have been secreted, what are the factors? Things like platelet activating factor, PAF. Those are the things that will be secreted, leading to the aggregation of platelets, forming what's called a plug. Okay, a plug is formed. So in this case, look at this. Okay, the blood clotting requires the following things. Okay, it requires calcium. It requires something called vitamin K. And you'll learn about vitamin K in biochem. Okay? So, by the way, let me ask you, are we naturally born with vitamin K? No. That's the reason why for those of you who are nurses, what do we do with babies? We inject vitamin K in babies because we're not naturally born with it. Vitamin K is, how is it produced? Does anyone know? The bacteria in our GI tract is what produces vitamin K. So when babies are born,